to introduce an incredible young woman whose journey defines strength and resilience, Katelyn Garcia. Diagnosed with cystic fibrosis at just 6 weeks old, Katelyn received her first double lung transplant at 16, becoming the first pediatric patient at New York's Columbia Presbyterian Children's Hospital to walk while on ECMO. After facing rejection 4 years later, she underwent a second transplant at 20. Once again, she fought her way back through determination and hard work. Inspired to help others, Katelyn founded The Air I Breathe, a nonprofit that provides essentials to hospital units and supports patients and staff. She also mentors others through Cystic Fibrosis Peer Connect, making sure no one in her community feels alone. Please join me in welcoming the remarkable and inspiring Katelyn Garcia.
Hi, I'm Katelyn. Sorry. When I was 6 weeks old, I was performed a sweat test, and that's how they verified that I had cystic fibrosis. And I lived a pretty typical life, as typical as one can live when you have CF. I had some usual admissions every here and then, but my weight was always usually not stable. I had physical therapy. I had the same physical therapist. She's not here, unfortunately, but it's Denise. She worked with me since I was a baby, and she still continued to work with me until I reached my 1 year post second transplant anniversary. I lived the usual life until the age of 6, when I had a G-tube placed to help me gain my weight back that I would lose consistently. And then after that, I had some admissions that would increase yearly. It would become like 3 to 4 times a year. And it became too much for my body, where I needed to have a port placed when I was 14. I still did my nebulizers, I still did my 7% saline, I still did my manual chest compressions, my chest vests. I still saw physical therapy when I would be in the hospital. It would just increase, so I would do treatment in the morning, nebulizers, chest vests, and then I would do manual chest compressions with my physical therapist, and then I would do like a fun little activity, like I would blow bubbles in a bin and see how many I can blow in one breath. I would do the hula hoop, I would hopscotch, I would take walks around the unit with her with my pole of IVs, and I would do my nighttime routine as well. When I was 16, my health took a huge decline. I came back from vacation and I had carbon dioxide poisoning. I was at home with oxygen for a while, but when I had a asthma flare-up, I couldn't control my breathing. It became very erratic, so I had to be rushed to the ER. And a little after that, I became very delirious. So a lot of that till this day is a little bit of a blur. But my family still tells me that the first step that they did was get my consent for me to be ventilated to help try to bring down the carbon dioxide I had. And once I consented, I was put to sleep, I was ventilated, and then when that didn't help, they had to do a trach on me. And when that didn't help, they proceeded to do ECMO. And that's when they started to see a huge difference in my carbon dioxide numbers. But in that same time, I was being evaluated with the Milstein in New York Presbyterian Hospital. And they immediately put me on the list for transplant. I got my first call like a week or two after being in my induced coma. And when they saw how fast that process was happening, they proceeded to start waking me up so that I would be in the best physical strength that I could be when I would go into transplant. And they stood me up. I started walking on a mobile treadmill with my ECMO, with my ventilator, with everything. I lost 75 pounds, so they wanted me to gain as much muscle as I possibly could in my legs so that when I would walk with, through the halls and stuff. Oh, there's no audio, right? Oh, shoot. There you go, okay.
Hear a little beeping.
Yeah, I stopped it. That's Marcin. And he would walk with me through the halls, and they would go to my room every day, and I could be in the bed, and they would do leg pushes with me. They would bring the fitness bands, and I would use the lightest one and pull myself up, pull my arms apart, kick my legs back and forth, just so I could get in the groove of getting my movement back and I wouldn't be bedbound. So pre-transplant and occupational therapy, when working with both teams before transplant, they try their best to make you you guys try your best to make us CFers or anybody who's getting a transplant as strong as we can be. It is intense because you have to bring out a side of you that you didn't even know existed. You have to really put your best foot forward and just, put everything in the back of your head and realize that you have to make it a priority for yourself and for your family to be as strong as you can mentally and physically. But the physical therapy consisted of just strengthening my core, my legs, my arms, and respiratory. They tried to make me feel as comfortable as I could be when I would be ventilated or I was on high flow, and my BiPAP settings were correct for my comfortability, just so I can not feel like I couldn't breathe, but just so I can be comfortable while I waited for my lungs. So before my first transplant, there was more of a focus on my respiratory health as well as my strength, as I showed on the previous slide of me walking with my medical equipment. But on the second transplant, before my transplant, there was a sense of priority when it came to my respiratory strength, because they didn't want me to rely on my high flow and BiPAP as often, but they still wanted me to be as comfortable as I could be. But they wanted me to not rely on it as much because they knew that if I did, then my carbon dioxide numbers would start to elevate, which is exactly what happened before my second one. But after my first transplant, the first 4 years were really good. I was traveling more. I was seeing my family a lot. I was hanging out with my friends. I graduated high school. I started my first year of college, but that all had to be stopped because I had antibody rejection. So they started me on IVIG therapy. I got admitted into the hospital, and they had to do plasmapheresis therapy, increased nebulizers, taking 5% saline because 7% was just too much for my lungs to handle. A little later, they put me on oxygen and began my rehabilitation. So I started going to physical therapy again. I started working with Marcin and Denise again, and they just tried to do what they could and with what I was able to do, which wasn't really a lot because at that time, with the way my breathing was and how I relied on the equipment to go to the bathroom. I had to, it just made me feel more comfortable. But physical therapy at one point became just too much, and I had to stop attending, which you don't do that. And after transplant, physical therapy, after my first one when I was 16, the healing and recovery after surgery was a walk, it was extremely easy. It was a walk in the park. I was sent home 3 weeks after and completed outpatient therapy a year after. And physical therapy was mainly focusing on strengthening my core in case of a situation where I would fall and I needed to pick myself back up after. But after the second transplant, when I was 20, it was harder. The first one is okay, but the second one is much harder than the first. And I had a lot of complications. I had GI bleeds. I had my right lung collapse slightly. I had my diaphragm collapse a little. I was in and out of ventilation. I had chest tubes placed and taken out. It was a lot. But I had lost all function of my legs because of how strong the GI bleed caused a shock on my body. So when I was in the ICU and we realized that I couldn't really walk, they would just work with me to sit on the chair when I could. And then I had these two amazing physical therapists who, from the adult side, his name is Richard. He came and he just started working with me hands-on, and he said, I already had, I think, 5 months in the hospital, 3 being after transplant. But he made it his mission, and he said, we're gonna get you standing and we're gonna get you walking because our goal is to get you home. And he did that. But he used a lot of stuff. He used Serosteti, he used, I'm not sure what that machine is called, but they brought it to my room every day just so I could be able to strengthen the legs that I had no feeling of. I lost, I was 80 pounds, but 30 of those pounds were it was just water weight. So once I lost that water weight, that's when the hardcore therapy really started. It took a huge toll on my mental health. I lost all my hair, so I had to shave it all off. Don't regret that. But it was really hard because, when you have CF, you do face a lot of challenges in your everyday life, but then to have gone through a first transplant and then going into rejection and then that being a walk in the park and then to just be bombarded with the fact that you have to go through it all over again and you have more complications than you did, that you didn't realize you were gonna have before. It's hard. It's a mental challenge, and you have to find the strength to do it and get through it. But I did do it, and I'm here today. So. So for respiratory therapy post-transplant, there weren't any restrictions as far as respiratory goes, but it was pretty much a bit of a shock to go from the usual regimen that I had, where it was trying my usual treatments in the morning and then going through my day, drinking my crayons, my vitamins, whatever, and then doing my treatments at night, to just waking up in the morning and drinking my transplant, anti-rejection medication, doing what I have to do throughout the day, and then just drinking my pills at night. So it was, I still had my trach for a week or two after transplant because it was still fresh. But they did work with me to, after it started to close down, they still worked with me on breathing regularly, finding my new cough, my new sneeze. I didn't realize I snored until after. So it was just, they were very hands-on with the respiratory portion of it. I still went to physical therapy. I did my whole year there. I still worked with Marcin. I still worked with Denise. I did not want to go to the adult side. It was just, it made me feel more safe and comfortable to go through this new transition with people who have basically raised me along with my mom. So it was a bit of an adjustment. But after the second transplant, that's when the real adjustment came, because I had such complications. It really affects my diaphragm. So the way that I used to cough isn't the same as how I cough now. I have now, I had to go on Trikafta because my sinuses took a hit, my kidneys took a hit. So it was just a lot of things taking a hit in my body that I needed to get used to and work with physical therapy more. The respiratory team on the ICU, bless them, because they really helped me so much. I really believe that if I wouldn't be here right now if it wasn't for them, because I couldn't cough. So all the mucus that I had in my lungs would just get stuck and it would clog my airways. So they brought me something called a cough assist, which unfortunately they only have 3 of them in the hospital. They only have them in the storage room. So she had to run down to the basement and bring it all the way up to the ICU. And I'd never heard of it. I didn't even knew that existed. I don't think, every time I mention it to any CF patient, they don't know that exists. So whenever I have my peer connect meetings that I facilitate, I tell them when they tell me that they struggle or they feel tightness in their chest, I ask them if they ever had electrotherapy where you put these 2 cups on the chest and then you feel the vibrations, the frequency, the high frequency in your lungs. And I tell them if that doesn't help, do a saline or an albuterol and just ask them for a cough assist if they can bring it to you. Because if you don't know how to huff cough, then that really helps you get in the habit of learning how to, and it makes you feel more comfortable with the fact that you're still learning how to cough and a new way to bring up the mucus. So physical therapy and respiratory therapy, I've had the same team since I was 3. Marcin joined a little later, but he's still here. And they taught me, they were the ones that taught me how to make myself cough, if I feel mucus in my throat, how to clear it up, if I feel nasal drip, how to take it out. But therapy is so fundamental. It's not only for your physical health, but your mental health. Because you start working on things that you didn't even know that you needed to work on. I didn't know that my balance was so bad until she made me stand on 1 foot for 60 seconds. I didn't know that. I had to learn how to jump again. So she would put cones on the floor and make me use my hip flexors just to lift my leg and go over the cone. I didn't even know I had to work on that until after. But it truly pushes you to your fullest capacity and your limits, and that your body can reach after everything. So I just want to say thank you to my team from Columbia Presbyterian, and my Kim. She used to be my nutritionist. So some are present and some are going to be watching this when I send it to them. So I just want to say a big thank you to them. They've truly been my backbone and my biggest support, especially my mother, Kim and Marcin. You guys know her. I'm sorry. And you know how she is as a single mom. I'm the youngest of 3. I'm sorry. I'm the youngest of 3, so she's done this something new, and she's never gone through anything like this before, and she truly pushes me. And I thank her because I am who I am because of her. And my team, you guys are the best, and you guys are the best as well. Oh, shoot, sorry. You guys are the best as well, because you guys really do so much for us, and we truly, I feel like you guys aren't as thanked as often for the work and effort that you guys put in every day, especially the families who deal with this, and the doctors and the physical therapists and occupational therapists and respiratory. You guys are geniuses in my head, because we really wouldn't be here if it weren't for you guys and everything that you do for us. So thank you so much.
I told you it was worth it to stay till the end. So.
Katelyn, thank you so much for being here today and being willing to share your story. I really think it exemplifies that transitions do not have any age associated with them. We think about what she has gone through already in her few decades of life, and it's pretty miraculous what the people in this room have done to help support her along the way. I know we are a couple minutes over, so I thank everybody for their time. I'm sure you have other sessions to get to and travel. Hopefully the presenters can stick around for